COVID-19 has taken a heavy toll on many Americans, but especially on healthcare workers. According to a Washington Post and Kaiser Family Foundation poll, 3 in 10 healthcare workers are considering leaving the profession. More than half are burned out, and a majority of them say stress from the pandemic has harmed their mental health. William Won wrote this piece for the Post and joins me now. He is a national correspondent covering health and science. William, thanks for being here. You spoke with several healthcare workers who have been struggling during the pandemic. Mentally, what are they going through?
There's a lot of just very worrisome symptoms we're seeing, everything from burnout to PTSD. Some, admitted drinking more as a way of coping, just exhaustion and apathy about their jobs, just kind of very widespread mental health symptoms that you often see, in soldiers returning from war, in first responders after a especially traumatic event. So some very worrisome signs. The one that's most worrisome, though, is this number. 3 in 10 say they've actually considered quitting. And I talked to several who actually are quitting their jobs, leaving medicine after, sacrificing so much to get into this field.
What did these workers say about our country's healthcare system and what role it's played in their burnout?
Yeah, a lot of them talked about the trauma of the pandemic, but even before the pandemic, you were seeing just very high levels of burnout already. And so what they talked about is how this pandemic has really exposed the cracks in the healthcare. All of these things, healthcare is it's so obviously broken in our country, but the brunt of that brokenness falls on doctors, nurses, respiratory therapists, all the way down to, like the administrative staff, just the amount of bureaucracy they deal with. And so a lot of them just talked about the sense that of exhaustion, and this system just doesn't work. And they're having to do all of this stuff on top of the trauma of the pandemic that they've been bearing.
William, I thought this was very interesting. A psychiatrist who has counseled dozens of doctors told you, quote, "We need to stop treating them like heroes and start treating them like human beings." I think that will be surprising for a lot of people hearing that, because in my mind, they are heroes. What they have done during this pandemic and continue to do is nothing short of heroic. So why is a psychiatrist saying that we need to move away from this hero thought to thinking about them more as human beings?
Yeah, this is the psychiatrist I talked to. She actually started an entire support line, similar to, we have the suicide hotline for just general public. She started one specifically for physicians and doctors. And what she was saying is, a lot of these health workers, they're talking about this feeling of betrayal from the public. They sacrificed so much during this pandemic to save, these people's lives. And so you have this clapping, we all remember the banging of the pots and the hero worship early on in the pandemic. And then, in subsequent months, you saw the public just wide swaths of it, refusing to wear masks, take basic precautions, even if it would spare healthcare workers from one more traumatic death, one more family they have to kind of walk through the pain and suffering of losing someone to coronavirus. So that kind of betrayal, and I think that is motivating a lot of this this kind of exodus from the field. The other thing is that she and other psychiatrists brought up is, when we talk about doctors and nurses as heroes, we're kind of putting them up on a pedestal, the care that they're giving is a one-way street. Whereas, we should really be thinking about health as, the healers need caring as well. It's not just a one-way street. There has to be caring for the people providing that.
Heroic without sacrificing the idea that these are humans that are giving so much of themselves. And William, I've absolutely heard that from the doctors that I've spoken with, how much it hurts them to see people not wanting to wear masks and the frustrations that they've felt at this stage in the pandemic. Speaking of psychiatrists, though, I just want to know, are there enough options for these healthcare workers to get the help that they need?
That's a huge issue. A lot of the experts I talked to noted how after 9/11, you had the commission kind of appointed, the 9/11 commission, you had all these programs and funding. Remember Jon Stewart kind of campaigning very heavily for funding for first responders for years, to treat the kind of the fallout of that. After Afghanistan and Iraq, you had soldiers coming back, and we have the VA and, underfunded, but still significant kind of programs for them, for their mental health. There's nothing like that for the health workers that kind of bore the brunt of this pandemic. And so there's starting to be kind of a push for this. There was some funding included in that relief package that the Biden administration pushed through. That will help, but there's not very much kind of infrastructure in the way that we're talking about that the soldiers or first responders got. We really need that. And so there's small steps like the kind of physician support line and other things that are starting to percolate.
And even just acknowledging that post-traumatic stress or current, it's not even post at this point, it's current traumatic stress that they're facing. I would be remiss, though, if I didn't ask you about, with the poll's findings, that 3 out of 10 healthcare workers are considering leaving the field because the U.S. was facing a shortage of doctors and nurses even before the coronavirus pandemic. What will happen if, in fact, a large number of healthcare workers end up quitting?
This is a huge concern. Everyone involved in healthcare knows this is like, even before the pandemic, we had a severe nursing shortage coming in coming years and already present in a lot of areas, especially rural ones. There is a doctor shortage already predicted that would be coming in the next 10 years. And so what the pandemic's going to do is it's going to only increase that pressure. And it's this kind of vicious cycle that starts, so you have more people quitting, which puts more pressure on the ones remaining in the field. That kind of burns them out and kind of pushes them toward the door as well. And so there's a lot of concern about this and not enough action because, you can only produce so many doctors and nurses in a year. It takes years to get them into the pipeline and done into the field. And so there's not even enough slots in med schools and nursing schools right now to produce what we need. It's a huge concern, and there needs to be a lot more funding, attention, kind of policy put into this.
William Won, thank you so much for your reporting and for sharing these stories with us.
Thanks so much for having me. I really do appreciate it.
If you or someone you know is thinking about suicide or needs emotional support, I want to tell you about the Lifeline. The Lifeline Network is available 24 hours a day, 7 days a week. Call 1-800-273-8255 to speak with someone. Remember, this is whether you are a healthcare worker or for any reason. It is open to all. The number again, 800-273-TALK. You can also go to suicidepreventionlifeline.org.